So I've been doing a parasitic cleanse. I'm on my 13th week of that. It's a rather strange dosing. So rather than taking a pill every day, you take a pill once a week, and then the second week you take 2 pills, the third week you take 3, and so on and so forth till you get to the 13th week, at which time you are taking 13 pills in one dose. Does that make you sick? Oh, hell yeah! So very nauseating, particularly when my husband is driving. I don't know what it is about his driving and this medication, but oh my gosh. I am now on the 13th week of that medication, so done with that one. Moving on to the next one, the new one, it's some other kind of anti-parasitic, is 2 pills 2 times a day for 2 weeks. Gosh, okay. So I get this prescription filled at Costco, and they hand me bags of stuff. And so I naturally asked, what is all this? And they're like, this is your medication. It was packaged in 2 pills per bottle. This is the most excessive packaging I've ever seen. But it does tell me something. It does tell me that I'm on an unusual dosage, that most people probably just take 2 pills and they're done with it. It was the same thing when I was on the first anti-parasitic drug. That one, the pharmacist even said, I've never seen a dosing like this before. It does make sense, though, that if you have Lyme disease, that other parasitic infections are going to take advantage of the fact that your immune system is not functioning the way it should, and there's other things going on, and they're just going to be like, woohoo, party in there. So in order to get rid of the Lyme disease, you then have to take care of the co-infections. There are people who go through antibiotic treatment for Lyme and even long-term antibiotic treatment for Lyme and still don't get better. Why? Because there's co-infections going on. So because I'm seeing a Lyme specialist, they know all about these other little buggers that can take residence in your system, and I'm getting treated for those. One funny side note, if your doctor's going to put you on some kind of anti-parasitic for your Lyme disease, be aware that when you get this prescription filled, the pharmacist is going to have like a full-on talk with you about worms when you pick up the medication. I was just like, and oddly enough, these medications are basically the same active ingredient in there as I see in the stuff that we give my dog, the deworming formula. So how am I feeling on all these anti-parasitics other than the additional susceptibility to nausea? Well, I've noticed I'm pale a lot of the times. I've got kind of like this vampire skin tone. I'm not really worried about it because I'm like, this too shall pass. It's all part of the process. And the best part of it is I feel like I'm moving forward and moving ahead and making progress in my Lyme disease. There's no better feeling than that. Just proud of the fact that I'm still out there, I'm still working, I'm still getting stuff done, cook dinner for the family every night, started veganism while this whole injury thing was going on. So I'd say my energy levels are good, or I wouldn't be doing all those things. So with regard to Lyme disease, I'm kicking its ass.